Doctors reveal FIV medical tests. Seniors over 70 should skip the hidden risks no one tells you. If you're over 70, you've probably heard over and over how important it is to get regular checkups and medical tests to stay healthy. And that's true in many cases. But what if I told you that some medical tests, even ones that sound like they're good for you, might actually cause more harm than help? As doctors, we see seniors being sent for tests that can lead to unnecessary worry, invasive procedures, and even serious complications. That's why today, I want to share with you 5 medical tests that many seniors over 70 might be better off skipping unless there's a specific medical reason for them. This might surprise you, because these tests are often recommended as routine, but the risks sometimes outweigh the benefits. Hi, I'm Dr. Anthony. For over 15 years, I've been helping seniors make smart decisions about their health, and one of the most important lessons I've learned is that more testing isn't always better. As we get older, our bodies change, and the way we should approach medical care changes too. Tests that might be helpful for younger people can be unnecessary or even risky for seniors over 70. Sometimes the problem isn't the test itself, but what happens afterward, like additional scans, biopsies, surgeries, or treatments that turn out not to be needed at all. Let's start with one test that's often overused in seniors' routine colonoscopies after age 75. Colonoscopies are important for detecting colon cancer, especially in your 50s and 60s. But for many healthy people over 70, the risks of the procedure can outweigh the benefits. Colonoscopies involve sedation and inserting a long tube into your colon to look for polyps. The problem is that as we get older, our tissues become more fragile. There's a higher risk of complications like bleeding tears in the colon and reactions to anesthesia. I had a patient named Harold who was 78. He felt perfectly fine, but went for a routine colonoscopy because it was what he'd always done every 5 years. During the procedure, a small tear occurred in his colon. He ended up in the hospital for several days and needed surgery to repair the damage. Thankfully, he recovered, but the entire ordeal was very hard on him. When we reviewed his medical history, he had no symptoms, no family history of colon cancer, and had already had multiple normal colonoscopies earlier in life. In his case, continuing routine screenings wasn't necessary. It's not that colonoscopies are bad, but for seniors over 70 who have had prior normal screenings and no symptoms, the chances of finding dangerous cancer are low, while the risks from the procedure go up. That's why many medical guidelines suggest stopping routine colon cancer screening after age 7 unless there's a specific concern. Another test that often leads to unnecessary trouble in seniors over 70 is routine PSA screening for prostate cancer. The PSA test measures a protein made by the prostate, and higher levels can suggest cancer. But PSA levels can also go up from non-cancerous causes, like an enlarged prostate or inflammation. The problem is that a slightly elevated PSA often leads to biopsies, more scans, and sometimes aggressive treatments that have significant side effects. I had a patient named George who was 74. His PSA came back a little high during a routine checkup, even though he had no symptoms at all. He ended up having a prostate biopsy, which caused bleeding and a serious infection. The biopsy found a very slow-growing cancer that likely would never have harmed him. But once the word cancer was on his record, he felt pressure to undergo surgery. After surgery, he experienced urinary incontinence and erectile dysfunction. He told me later, "Dr. Anthony, I wish I'd never done that test. For many men over 70, routine PSA testing may cause more harm than good, because most prostate cancers at this age grow so slowly, they'd never cause problems during a man's natural lifespan. Instead, men and their doctors should talk about risks and benefits before deciding on PSA screening. It shouldn't just be automatic. Another test that's often unnecessary in seniors over 70 is routine carotid artery ultrasound screening in people without symptoms. The carotid arteries in your neck supply blood to your brain, and sometimes they can develop plaques that increase the risk of stroke. But studies show that screening people who have no symptoms often finds plaques that are not causing any problems. Once those plaques are found, doctors may feel compelled to do further tests or even surgeries, which can have serious risks. I remember a patient, Linda, who was 72. She went for a community health fair where they offered free carotid ultrasounds. The test found a small blockage. She ended up having several follow-up scans appointments with a surgeon and was even scheduled for surgery. But when we reviewed her case, the blockage wasn't significant enough to cause any symptoms or danger. In the end, she avoided unnecessary surgery, but the entire process caused her months of worry and stress. Screening for carotid artery disease in people without symptoms doesn't usually prevent strokes and often leads to overtreatment. That's why most medical groups recommend against routine screening, unless you have specific symptoms like strokes, transient weakness, or loss of vision. Another test that often causes more harm than good in seniors over 70 is routine whole-body scans, or full-body CT scans for cancer screening. Many people think, why not look everywhere and catch something early before it becomes dangerous? But the truth is, scanning your entire body without any symptoms can lead to false alarms, unnecessary biopsies, and exposure to significant radiation. I had a patient named Barbara who was 73. She saw an advertisement for a private clinic offering a full-body scan to look for hidden cancers. She paid out of pocket for the scan because she thought it would give her peace of mind. The scan found a tiny spot on her lung, which led to several follow-up CT scans, a needle biopsy, and weeks of anxiety. In the end, it turned out to be a harmless scar from an old infection. But Barbara went through so much stress pain from the biopsy and unnecessary medical bills. She told me later, "Dr. Anthony, I wish I'd never done that scan. I thought I was being proactive, but it just made my life miserable for months." The problem with whole-body scans is that they often find things that look abnormal, but aren't dangerous. Doctors call these incidental findings. Once a doctor sees something suspicious on a scan, it's very hard to ignore it, even if it's harmless. That can lead to more tests, biopsies, and sometimes even surgeries for things that never would have harmed you. Full-body scans also expose you to a lot of radiation. For example, a full-body CT scan can give you as much radiation as hundreds of chest X-rays. While one scan might not cause immediate harm, repeated exposure over time raises your risk for developing cancer in the future. For people over 70, the risks from radiation and unnecessary procedures often outweigh the benefit of catching something early, especially if you feel healthy and have no symptoms. Another patient, Robert, who was 70, went for a full-body scan because his friend convinced him it was the smart thing to do. The scan found a small spot on his kidney. He ended up having surgery to remove part of his kidney, even though the spot turned out to be harmless. After surgery, he developed complications with bleeding and spent over a week in the hospital. He told me, "Dr. Anthony, I went in healthy and came out with problems I never had before. Sometimes it's better not to go looking for trouble unless there's a good reason." That brings us to another test that's often unnecessary for people over 70. Routine bone density scans, also known as DEXA scans, in people who already have a diagnosis of osteoporosis and are on treatment. Let me explain why. Bone density scans are very useful for diagnosing osteoporosis and assessing fracture risk, especially in women after menopause or in older men. But once you've been diagnosed with osteoporosis and your doctor has you on treatment, repeating the scan every year often isn't necessary. Bones don't change that quickly, and frequent scanning doesn't usually change how doctors manage your treatment. I had a patient named Carol who was 72. She had been diagnosed with osteoporosis at 68 and was faithfully taking her medication. But every year, she was sent for another DEXA scan, and each time the numbers varied slightly, leaving her confused and worried that her bones were getting weaker. In reality, the small changes were within the margin of error for the test and didn't mean her bones were dramatically worsening. After discussing it, we decided to extend the interval between scans to every 3 to 5 years, which is what many medical guidelines recommend once treatment has started and things are stable. Carol felt relieved not to have the constant stress of yearly testing. Over-testing bones can cause unnecessary anxiety and sometimes lead to changes in medication that might not be needed. For most people already diagnosed, and being treated, repeating bone scans too often doesn't help and only adds worry and cost. It's important to understand that the purpose of medical testing is to help you live longer and healthier, not to create new problems. Some tests are life-saving, but others might lead you down a path of worry, unnecessary treatments, and even harm. That's why personalized medicine is so important for seniors over 70. One-size-fits-all testing is not always the right answer at this stage of life. As a doctor, I always remind my patients that if a test is being suggested, they should feel comfortable asking, "How will this test help me? What happens if the result is abnormal? Will it change how we treat my health? And what risks are there from the test itself?" Those questions can help you avoid tests that might cause more harm than good. In the next part, I'll share practical tips on how to discuss testing decisions with your doctor, and one more patient story showing how skipping unnecessary testing helped someone avoid serious complications. Let me share with you one more story that perfectly shows why sometimes skipping certain tests can be the healthiest decision. I had a patient named Frank, who was 76. Frank was in generally good health, very active, and loved playing golf. One day during a routine checkup, his doctor suggested a full-body scan just to look for anything hidden. Frank thought it sounded like a good idea because he believed catching something early could save his life. He paid for the scan out of pocket. The scan showed a tiny nodule in his lung, just a few millimeters in size. Frank became extremely anxious and started losing sleep. His doctor ordered more CT scans, which exposed him to additional radiation. The nodule wasn't changing in size, but Frank was so worried he wanted it biopsied. The biopsy caused a collapsed lung, and Frank ended up in the hospital for 3 days. In the end, the tiny nodule was completely benign and harmless. Frank told me afterward, "Dr. Anthony, I went from being healthy and happy to horrified, and in the hospital, all because of a test I didn't even need." His story is not unique. This happens more often than people realize. The truth is that many tests, especially in seniors over 70, come with hidden risks. Sometimes not knowing about small findings that will never harm you is actually safer than discovering something that leads you down a path of unnecessary procedures. This is why medicine has shifted to focusing on high-value care tests and treatments that truly improve your health and well-being, rather than just finding things for the sake of it. So what can you do to protect yourself? The first and most important thing is to always ask questions. When a doctor suggests a test, don't be afraid to say, "Why do I need this test? What will we do differently depending on the results? What risks are involved, and is there an alternative or a way to simply monitor the situation instead?" A good doctor will welcome those questions and help you weigh the pros and cons. Second, remember that guidelines exist for a reason. Organizations like the U.S. Preventive Services Task Force spend years studying which tests are helpful and which might cause harm, especially in older adults. For example, routine colonoscopies, PSA screening, carotid ultrasounds, full-body scans, and frequent bone density tests are not always necessary for everyone over 70. Guidelines suggest stopping some of these screenings if you're healthy and not experiencing symptoms. Third, trust your body. If you feel well, have no new symptoms, and your doctor doesn't find anything concerning during your exams, sometimes the best choice is to simply watch and wait. Medicine isn't just about testing everything all the time. It's about balancing risks and benefits for each individual. Another patient of mine, Diane, who is 74, was scheduled by her previous doctor for annual colonoscopies, even though her past two were completely normal. She dreaded the prep, felt exhausted after sedation, and experienced low blood pressure after each procedure. When we reviewed her health, we decided that routine colonoscopies weren't necessary anymore because her risk was low and her prior tests were clear. Diane was so relieved. She told me, "Dr. Anthony, I feel like I got years of my life back without worrying about that test every year. I want people over 70 to know that it's okay to say no to tests that aren't truly needed. It's not about neglecting your health. It's about protecting yourself from harm. Medicine should serve you, not the other way around. Tests should be done when there's a clear reason and when the result will change what we do next for your health." Let's quickly review the 5 medical tests that seniors over 70 should carefully consider before doing. 1. Routine colonoscopies after age 7 if you've had previous normal results and have no symptoms. 2. Routine PSA screening for prostate cancer in men without symptoms. 3. Routine carotid artery ultrasounds in people without symptoms. 4. Full body scans for cancer screening without any specific reason. And 5. Frequent bone density scans in people who are already diagnosed and under treatment. These tests are not evil, and sometimes they're absolutely necessary. But for many seniors, the risks can outweigh the benefits, leading to unnecessary anxiety, dangerous procedures, and complications that could have been avoided. If you're over 70, you deserve health care that's tailored to your unique needs. You don't have to accept every test just because it's offered. You have a right to ask questions and make choices that protect both your health and your peace of mind. If you found this video helpful, please subscribe to this channel for weekly doctor-approved health tips designed especially for people over 60 and 70. Give this video a like so that more people can learn about these important issues and avoid unnecessary risks. And leave me a comment below. Have you ever had a test you wish you hadn't done? Or is there another health topic you'd like me to cover in a future video? I read every comment, and your stories help me create videos that truly help people. Thank you so much for spending your time with me today. Take care of your health and take care of yourself. I'm Dr. Anthony, and I'll see you in the next video.